every day and every week it's evolving. And so taking a look at our team and kind of reevaluating team needs versus client needs versus patient needs. I think we have a triangle effect in veterinary medicine, whereas human doctors, they're just looking at the patients, without having to look at everything else. And so for us, our first layer would be the clients, trying to explain to them we're still curbside. And obviously, when I logged on, I had my mask on. So we're within 6 feet of each other. We are wearing our masks inside the building too. We have streamlined and updated client information pretty much every week as far as here's our numbers, here's when we will let you back in the building. But in our area, vet med, we are very much in the client space with doing predominantly rehab and sports medicine. And so we need the clients to stay away to allow us to be healthy. And if we're not healthy, to allow us to not give it to them. Now we're having to leverage technology. So we're doing Zoom meetings with clients. We're doing Skype with clients. We're allowing them to be with us. FaceTime with my phone. I just carry my phone around. We're taking videos and pictures of the dogs, and we're treating them in front of the windows. And that way the clients are on the outside, and we've set up benches so that way they can be with their pet, but keeping all of us safe. For us, another big hurdle was our mamas that work for me. And so we have a lot of moms that are trying to wear multiple hats. So shout out to all of our moms trying to get through this pandemic with small children. So we created in our very small business an opportunity for our mothers to work from home from March to June. And so they were able to homeschool their kids. And then we outsourced our phone lines to them, and we outsourced all of our computer client information. So we created in Vet Med the first kind of telemedicine job, if you will, to where we were able to still pay our moms. They were able to still take that paycheck. They were able to teach their children and fill a need with our facility as well. We have been very, very grateful to be able to add in an additional mental health days where we're able to tell our teammates, hey, take tomorrow off. Today was a rough day. Take tomorrow off. Go home. You're getting paid for it. You're not having to make that decision on your sanity to be here to help take in dogs. So it's really been that triangular effect. And then still the business of veterinary medicine, still trying to keep your lights on, still trying to get your overhead met and staying healthy. I think our intake exam has carried more weight now than what it did pre-COVID. When people were coming in pre-COVID, I don't even know if they paid attention to all the hard work that went into our intake evaluation, getting all of our objective data and, stance analysis, our digital thermography, our goniometry, our radiographs, and putting all this together. And now we're putting that together in a nice, neat portfolio for the clients. And we're going back through it every 4 weeks and showing them the progress. And so initially when people would come in, ironically, when people would come into the building, they would not commit to as much.
Right.
So we're seeing longer committed clients, more committed clients, and we're seeing better outcomes because we're able to put the total package together for these clients instead of piecemealing. And so many times in vet med, they come in and they see what all you can do and they tell you what they want. And now we're able to sit here and say, hey, pay attention to the data. This is what your pet needs. But we're taking in on average 4 times the amount of new clients now than what we were doing pre-COVID. We have a lot of podcasts that we've put together on our website for clients, kind of going over all the modalities that we offer. So we have a podcast about laser therapy, or AKA photobiomodulation. We have a podcast even about our stance analysis. So we're able to show people what we're doing before we're doing it. And then we have videos and pictures as well. So we're really leveraging that technology and giving the clients links to this is what we're doing inside, but now you can go and read this. This is what normal looks like, and this is the process of getting these numbers. So that part I think we're going to keep because clients are really endeared to following the whole process. Reiterating the mental health day for your teammates. I think that's probably been the biggest thing from my management perspective that we never would have implemented without COVID. We had built-in PTO days, and so we were using those. But I think with the movement of not one more vet comes the early recognition of burnout signs and listening to your teammates. We're working in closer proximity now than we were because we're just working out of one room. There's no need to use the whole building when we don't have clients filtering through it. So we're able to see those signs